you to take back with you and distribute as you see fit. I'll also just request that you all keep your devices muted while the presentation is going on. That way we can make sure that Dr. Stahl has every opportunity to present us the information that is going to be important to all of us. Many of you may know Dr. Ronald Stahl. He's the Chief Medical Officer here at our hospital, Wilson Medical Center. Has been here almost 5 years at Wilson Medical Center. Prior to that, he was in a Chief Medical Officer role in Syracuse, New York for 10 years. And then prior to that, was a practicing OBGYN for the better part of 20 years. So and he is also, in fact, a veteran, so we appreciate his service. He's a veteran of the Air Force and has practiced overseas during the Gulf War. So we are grateful to have Dr. Stahl here in Wilson and to bring us what we hope is going to be maybe some encouraging news for us, but if not encouraging, at least accurate information for us to go on. So without further ado, I think we have as many folks included in our call as we're going to get today. I'm going to turn it over to Dr. Stahl. Dr. Stahl, I am in the process now of making you our host so that you have the opportunity to share your screen as you see fit. So I'll turn it over to you, sir.
Thank you very much, Ryan, and welcome everybody. I do hope that this is at least somewhat educational and potentially a little bit entertaining. I know Ryan had said for all of you to keep your items on mute. However, if there's a time during the discussion that you have a question, you want to throw out a thought, or something's not making sense or isn't perfectly clear, feel free to jump in. I want this to be more of a relaxed conversation than I do a one-way discussion, if you will. So I do have a presentation I put together. I'm going to share my screen, I hope. I am not always the best at this. I will be very honest to say. Oh, I don't want that. Let's go here. All right. Everybody see my screen okay? I see heads nodding, so we'll move forward. So what I want to talk about today is really some ideas around COVID-19, how we got to where are we now as far as our current status, what's the most recent recommendations from a testing standpoint, and then most importantly, and hopefully spend most of the time really talking about how do you manage this within the workplace, looking at what is appropriate from a standpoint of managing employees and ensuring their safety. So let's get into it. I think most people know what's on this slide. I just wanted to briefly go through the history to a small degree. I think all of us know COVID-19, what it's capable of. It is a coronavirus. Coronaviruses are very common. There are a lot of them throughout that we've come in exposure to over the years. It's not something unique from a family standpoint, but this is a very unique coronavirus. Coronaviruses typically cause mild GI symptoms or mild respiratory symptoms. This one is very different. It is very highly contagious. It is much more contagious than the flu on a normal standpoint, thereby creating much easier spread of this disease than what we typically see with flu or flu-like symptoms. Spread by droplets. What do I mean by that? Well, when you look at spread from an infection standpoint, it's really spread by small little droplets that come out of our mouth, nose, when we cough, when we sneeze, when we are talking, that really carry the virus to the next host. Typically, those droplets don't travel more than about 5 to 6 feet before they fall to the ground. That's what's led to the 6 feet of social spacing, which we'll get into more as we move through this. Interestingly, the incubation for this virus is between 2 to 14 days. And that's a little unique in that can be a fairly long incubation time period. That's what makes it so difficult when it comes to tracing and trying to determine who that person may have been in contact with or who may be at risk from contacting that person. Because if they get infected, you don't know if they're early on and from an incubation standpoint of 2, 3, 4 days, or if they're at the end or closer to 10 to 12 days. So you end up, makes it very difficult to go back and try to figure out those contacts. It can be spread off of surfaces. And this is probably one of the most frustrating things. It's not common and it doesn't happen a lot, but this is why the rationale and the reasoning is out there to clean surfaces frequently, especially surfaces that are high touch. Soap and water, Lysol spray, surface cleaners, but you just need to clean those surfaces as much as you can. And as we all know, there's no absolute treatment, cure, or vaccine at this particular time. So how do I prevent getting this? How do I prevent myself or protect myself from this virus? The 3 W's still come in mind. Wash your hands with soap and water, wear a mask, and watch your distance. That is that 6 feet of social distancing. When you wash your hands with soap and water, though, it needs to be for 20 seconds. Simple way to remember, hum Happy Birthday song twice to yourself. That takes it right at 20 seconds of time, and it helps make sure that you're washing your hands appropriate time period. Clean high touch surfaces frequently. Obviously cover your sneeze or cough. If you happen to not have a mask on as someone's walking in the room or for whatever reason, be sure you cover that cough or sneeze. Most importantly, monitor your health. Know if you're feeling poorly. Know if you have any concerns. Know if you've had a fever, you're feeling tired, you're feeling more weak than usual, you're having more nausea than what you normally have, which hopefully is none. These type of things. Try to be in touch with how you're feeling. And lastly, avoid large groups. Now I know that there's the order that's come out from the governor that he's extended talks about no more than 10 people inside, no more than 50 outside, or maybe it's 25. I don't remember, to be honest. You want to minimize your exposure to large groups, just because that makes this transmission very easy. You see on the news all these people that go to the beach and have large beach parties, or they're out on large boats having many people in contact. That's where it's easiest to pick up this disease. So protect yourself, encourage your staff obviously to do the same. Just one comment on mask wearing, and I think all of us see this on a regular basis. Wearing your mask properly makes a huge difference. And it does have to cover both the nose and the mouth, and it needs to fit fairly well around the face without huge gaps. Now, it's never going to be a really tight fit, especially a cloth mask, but you need to make sure the nose and the mouth are both covered. Allow for breathing, and make sure that if you're using cloth masks that you're washing them frequently. Don't be wearing the same one without washing it for 2 or 3 weeks at a time. So let's talk a little bit about where we are from a data standpoint. So this information is up to date as of noon yesterday. I did not get a chance to update the slides for today, so I apologize for that. So in North Carolina, currently we have had 129,288 total cases with little over 2,000 deaths. The concerning part is we still have 1,167 that are hospitalized. That's a large number. If you go back and track this back in time, as of June 1st, we were sitting at about 650 hospitalized across the state. So unfortunately, it has gone up. Now it went up as high as over 1,200 and has come down some now. And it does look like, and you'll see this on some of the graphs, it does look like that we're starting to make some headway in flattening the curve and actually hopefully driving the curve downward, which is what we all want to see. So this shows that. If you look at the total daily confirmed cases across the state, out of that 129,288, you'll see that the last week, the trend curve, which is in yellow, looks like it's starting to come down. And we're hopeful that that continues. We've seen that at the hospital. We had as many as 27 patients with COVID admitted to the hospital 3 weeks ago. We are now down to 10 today, and we were single digits the last 2 days, 8 to 9. So there has been a substantial change and substantial improvement, which is really what you want to see, obviously. Interestingly, 44% of those positive cases across the state are in the age of 25 to 49. So that's your vibrant health, your vibrant workers, your active middle class that are involved in the community doing things. Almost half of the total cases have come from that age range. But only 5% of those patients have died. And that's what the second side shows, the blue bars. Vast majority of the deaths are 75 years and older throughout North Carolina. Now, when you compare this with Wilson County, the graph is pretty much the same. You'll see a nice downward trend. The age group is pretty much the same, 42% instead of 44 in the 25 to 49 age group. But what's interestingly is that we have younger people dying in this community than across the state. The highest death rate is actually in the 65 to 74-year-old age group. Now we know that we have a lot of people in the community who have substantial and significant medical conditions. There's a lot of lung disease, there's a lot of kidney disease, there's a lot of heart disease in the community. That very well may be a lot of what drives this, because when you look across the state, obviously it includes everybody from all walks of life. So this is of a little bit of a concern, and we certainly want to make sure that we're doing everything we can as a community to help protect each other so that we can help bring that rate down. Lastly, last thing I'll look at from a data standpoint, North Carolina, this is hospitalized patients. And we look at this predominantly because these are the ones that are sick. These are the patients that are consuming resources, are in the hospital, requiring a lot of care. You can see that the curve appears to be flattening. And that's a really good sign, a really good sign. Not as much on the eastern side of the state. Now, the state is divided into different healthcare preparedness coalitions. And the eastern group, which I've circled on the map in the bottom part of that slide, is where Wilson lies. Now, it's a large contingency. It's a lot of different counties. Wilson County seems to be doing better, but across the whole entire eastern part of the state, there still seems to be a slight uptick in hospitalizations. So as you're out and about, keep that in mind. Help your employees understand that though it's improving, appears to be improving within Wilson County, that's not necessarily consistent throughout the entire state yet. All right. So I think everyone has heard about the testing. When you look at this picture, you can see how it's done. We either do it by nasal swab or by oral swab. Most of the time, and the standard has been nasal swab. I will tell you, most people who have it done think they're having the back of their brain biopsied, because you do, for most tests, you do need to get in fairly deep and make sure that you get a good sample. There are two different types of tests in general that are performed. One is viral testing and one is antibody testing. I'm going to address antibody first because that's the easiest. Currently, there's no literature or recommendation from the CDC, from the World Health Organization, that suggests regular use of antibody testing. It's not been shown to be really effective as of yet. We're hopeful that there's going to come a time when it does and we can test people and know who has been exposed. But the other piece we really don't know at this point is once a person develops the antibody, how long does the antibody last? There's been some very preliminary data that suggests it's about 3 to 4 months, but nobody really knows as of yet. So the typical testing we do is viral testing, and that's really done most usually in the lab. You will see some point of care testing, some places that'll say we can get you the results in 30 minutes or 20 minutes, this type of thing. Those are typically not quite as reliable as the laboratory tests. And there are now some laboratory tests that are rapid turnaround. But I think most of you probably are aware that that labs are becoming overwhelmed with the number of tests, and the turnaround time for these tests is now lasting as long as 3, 4, 5 days, sometimes a week. And that's very unfortunate, and I'll explain why here shortly, because that impacts what happens to that person. So who should get tested? Basically, there are 5 different categories of the public that should be tested. Obviously, anyone with symptoms, and we'll go through each of these in just a moment. Asymptomatic individuals with known or suspected recent exposure. So these are people who have a family member that comes down positive. These are the individuals for which contact tracing is performed. You find somebody who's positive, you want to make sure that you trace back and figure out who had they been in contact with that would put that person at risk. So who have they had significant close contact with, these type of things. There's asymptomatic individuals without known or suspected exposures that live in environments or are in environments of special settings, such as long-term care facilities. We'll discuss that briefly. Individuals being tested to determine resolution of infection. I'll get into more detail about that in a moment. And then individuals being tested for purposes of public health surveillance. This is what you see on TV. These are the lines of cars waiting to be tested. So when you first look at individuals with signs or symptoms consistent with COVID, what are they? What are the signs and the symptoms? When we first started diagnosing and treating this disease, it was fever, chills, cough, shortness of breath, or difficulty breathing, and that was it. Those were the symptoms we used to make a determination whether we're going to test someone. Because the learning around this particular disease is ongoing, we are still figuring out what are all the symptoms that are associated with this. And as time has gone on, fatigue, muscle body aches, headache, etc., have become much more common. What we're seeing now is loss of taste and smell, nausea, vomiting, diarrhea are not at all uncommon symptoms we're seeing in patients who then test positive. So it is a much broader spectrum of patients than what we initially thought based on the evidence that we had at that time. When you're looking at asymptomatic individuals who have had an exposure, this, as I mentioned, is where you get into contact tracing. And this involves in determining whether they have truly had close contact. And what that is within 6 feet, without a mask, without any type of protection for at least 15 minutes. Family member comes down with it, that pretty much fits the bill, doesn't it? You're really within that range pretty quickly. Coworkers can fit into that. If you're in an environment where someone tests positive today and yesterday you were having lunch with them in the break room, or you were spending a lot of time in a meeting working with different things and neither have a mask on, that would put you at some risk. I will say that the health department is really the organization that is in charge of the contact tracing. They drive this, they do a good job, and they reach out to the people that they believe are at risk to have discussions. I do also have to say that their job is sometimes very difficult, frequently very difficult, and they run into situations where the person who is infected is not willing to share who they've been in contact with. So it makes it difficult to reach out and ensure that there is the ability to identify those who may be at risk and test them appropriately. The other piece of this is that the timing of doing the testing can be somewhat tricky. If someone has been exposed today to somebody who tested positive yesterday, testing them today may not be the appropriate thing to do because they may still be too early in that incubation time period. And you may need to wait 3 or 4 days to get a more accurate test. Asymptomatic individuals who live in special settings, this is really your at-risk populations, nursing homes, assisted living. These are patients that get tested who are asymptomatic in situations such as what we went through here at our Wilson Rehab and Nursing Care Center, where we had an outbreak of COVID, and we ended up testing everybody in the facility for about 4 weeks straight. Everybody's negative now, we're all clear, everything's good. But that was needless to say, a stressful situation. When we first started this whole process of managing these patients, we felt that it was important to test patients at the end to ensure that they were negative. This is no longer recommended. And the reason this is no longer recommended is that it has been found that patients will continue to shed pieces of the virus for which are tested, that is the outside covering or part of the RNA that is in the virus. That will still be shed, but the virus is not infectious. So we've known people that have been into the testing positive for 35, 40 days. When in all honesty, their infectious time period probably ended after about 15 or so. And we'll get into that a little bit more as well. And then lastly, obviously, are the ones that are for health surveillance. These are your drive-in testing sites, really driven usually by the health department. I know that the Wilson County Health Department, along with the Community Health Center downtown, have had 2 different events with drive-in testing and have tested between 150 to 200 each time. This is really more looking at prevalence and an effort to try to pick up those that are asymptomatic to try to decrease exposure. So, when should you get tested? As I mentioned, the timing is difficult. If you have somebody at work who has symptoms and gets tested and is positive, then when do the coworkers get tested, or when should they get tested, or should they get tested? And we'll go through all that in a moment, but the timing of it is very difficult. We know that the highest time for infectivity is somewhere between 5 to 7 days after exposure. But we know that the incubation period can be as short as 2 and as long as 14. So it's a little tricky trying to find that sweet spot as far as the testing goes. Yeah. So within your work environment, what can businesses do that can help decrease exposure for your employees, for your customers, for yourself. First and foremost, we strongly recommend screening employees daily for symptoms and fever. I can tell you, we've been doing this at the hospital now for, I don't know, probably 3.5, 4 months. Every day I walk in, I have my temperature taken. I fill out a sheet that to answer questions as to how I'm feeling, if I'm having any symptoms or if I've had any exposure. And then we keep all of that log. Don't know that you necessarily have to have a log at work. That's really a decision for each business. But I do think it's important to ensure that your employees, when arriving, are not ill, because that's really important. Sounds silly, but people do come to work sick, and I think all of us have seen it. And I've seen it here in the hospital several times. Wear masks, wash your hands, socially distant. I don't know how else to emphasize the fact that wearing masks does make a difference. Keep in mind that the wearing of masks in public or at work, especially cloth masks, are not necessarily geared towards protecting you as much as they are geared to protect those you come in contact with from you. So if everybody is wearing a mask, then everyone's protected. If you're in a store or you're out walking around in a large public area and you're wearing a mask and there are a number of others that aren't, then they are potentially exposing you. And that's unfortunate. Strongly encourage employees who are sick to remain home. That sounds silly, and I think all of us do that on a regular basis. But if you have employees like we do, people are dedicated and they want to come to work, or they feel like they can't take the time off, or maybe they don't have a lot of sick time, or they haven't built up sick time, or whatever the reason may be. But they seem to want to come to work regardless. Encourage them. If you're not feeling well, call us. Let's talk it through, determine what the next step is. And if they do arrive to work sick, first and foremost, if they've got symptoms of COVID, separate them from the rest of the staff. Get them into a separate area and get them home. If you need to call someone to come get them or help them with a taxi or whatever, but get them home. And if they're truly sick, encourage them to contact their provider and let that provider make a determination regarding whether they need to be tested. Once they're tested, as we talked about before, frequently there's a significant time frame from when they're tested to when you get the results. How do you manage that? In employees, people who are tested because they have symptoms, waiting on results, or those who are tested without symptoms because of contact tracing or any other reason, they should be home, quarantined at home. It's not isolation, and I'll get into the difference in a moment, and treat as if they're positive until you know otherwise, for their safety and the safety of all of your employees and the community. So they should stay at home. Ideally, they should be wearing a mask if they're coming in contact with other people. Doesn't mean they can't go outside in the yard. Doesn't mean they can't take a ride in the car, but you really don't want them, you want to discourage them going out doing any shopping unless they live alone and there's no other option. These people need to be home, need to be safe until they know what the results are. So what if they test positive? What do we do now? First and foremost, they can't come back to work until they meet the requirement to return, which we'll go over shortly. If you can, if they happen to have their own office or they have their own workspace, if you can close off that area to the best of your ability, ideally for up to 24 hours. The reason for that is if there is virus, if there is COVID that is on the surface, it won't survive beyond 24 hours from the best studies that we can tell. And then have your staff go in and make sure that it gets cleaned well. Inform your staff that an employee is positive. It's important they know that there's an employee positive, but unfortunately you can't share who without the employee's permission. That's the health department's job. And that's why it's important that's why all positives are reported to the health department, who then contact the person who's positive and then begin that contact tracer process. If you can easily determine who may be exposed, that may be helpful to the health department. So if you have employees that are exposed, what should they do? And this is where I think most businesses really struggle, and I totally get it. It makes perfect sense. If you've got one person out and there are 3 others that have been through contact tracing determined to have significant exposure, they potentially may need to quarantine for 14 days at home, even without symptoms. Need to determine how long they were worked with the patient, with the employee that was infected, and how close they were physically to each other during that time. If they have symptoms, obviously you're going to go down the road of quarantining them and testing them, recommending that they get tested. But even without symptoms, the recommendation from a public health standpoint is to quarantine them for 14 days. That's that 14-day incubation time period. That probably is one of the toughest things to do if you're an employer, is sending someone home who is feeling well and telling them he can't come to work for 2 weeks. So what is the difference between quarantine and isolation? And we hear these terms a lot in the press. Quarantine is keeping someone secluded, but not locked in a room, if you will, or that type of thing. It's really keeping them at home, keeping them on minimal activity. They can go out in the yard. They can, as I said before, they can take a drive in the car. We prefer they not go shopping and that type of thing. They need to limit activity, and they should wear masks at all times until such time as either the quarantine's completed, 14 days, or if they're quarantined waiting for test results until they get the results back. Isolation occurs once you have a positive test. And this is a little bit of a step up. It's when the employee goes home and ideally needs to stay in a single area of the house, ideally again with their own bathroom if at all possible, and stay away from everybody else that's in the house, and certainly stay home and not be out and about. If they need to come out of the room to go to the bathroom or for whatever reason go to the kitchen, they should always have a mask on the entire time. That's really important to help protect anyone else that's in the house. Obviously, single people, this is tough. And what's also tough are people that are in families when there's not a lot of space at the home. So you do the best you can. And not everybody's got the opportunity to have a separate bedroom and bathroom that's isolated from the rest of the house and have people who are going to bring them food and bring them drinks and make sure that they're good and keep them separate from everybody. But the more that can happen, the better. So once they've been infected, when can they come back to work, or if they're quarantined? So obviously, quarantine after exposure, we talked about that, 14 days of no symptoms. If they develop no symptoms, 14 days, they can come back to work. If they're positive, and this is where it becomes really, people really question it. If they're positive and they have symptoms, 10 days from the onset of symptoms, 24 hours with no fever, with taking no fever reducing medication, and the symptoms have significantly improved. And if they have, for whatever reason, were tested with no symptoms, 10 days, then as long as they don't develop symptoms, they can return to work. This is where people get really nuts, because you're initially taking somebody who has been exposed, and you're sending them home and saying you're home for 14 days. But the ones that are tested positive, you're saying 10 days, and you're likely going to be ready to come back to work unless you get really sick. 14 days is due to the potential incubation time period. It's been that way since we started working with this particular infection, and I don't see that changing. Initially, with positive tests, we were doing 14 days, and that is, with research and better understanding of the disease, that has been brought down to 10. If you have employees who travel, just a few suggestions in having conversations with them, either if they're traveling for work or if they're traveling on their own. Talk to them about, is the travel absolutely necessary? I can tell you that my wife and I recently purchased a small little place in Florida, and we were planning on going down the weekend of July 4th. When we started watching what was going on in Florida, we made the decision, we'll wait. We'll go down in a month or two, hopefully, if things start settling down. But right now, we don't want to go down and subject ourselves to what's happening in Florida. So encourage your employees or yourself to know what's going on, where you're going. And are there travel restrictions there? I think most of you know Connecticut, New York State, and New Jersey. If you travel there from North Carolina, you need to quarantine for 14 days or the duration of the time you're there. That's a law they put in place. There are other states with restrictions. Alaska, for example, will not allow you in the state without a negative COVID test within the last 24 hours. Are there restrictions upon returning? In North Carolina, there are not. Other states, there are. Had a friend of mine that had a family member travel down from New York State to visit for 2 days, was here for 2 days, went back, and he wasn't allowed back to work for 14 days. I really strongly recommend you avoid international travel and cruise ships. Very, very difficult to do social distancing on a cruise ship. Anyone who travels internationally is going to need to quarantine for 14 days when they get back. And most important, if you travel, wear a mask, wash your hands, watch your distance, and avoid large groups. I don't know what else to say there. That's just really, really important from a standpoint of helping to prevent the spread of this disease. So my final thoughts, when you look at the workforce in general, screening employees to the best of your ability. If you have a process that you can do that, that's great. Get the sick employees to stay home and test, and recommend that they test or at least be seen by a provider if you feel it's important. Send those who are sick home and have them see a provider. If you have someone that's positive, make every effort to close off their work area for as long as possible, up to 24 hours. And then clean it very thoroughly. Quarantine exposures for 14 days. And keep in mind that return to work is really based on 10 or 10 plus 24, the way I like to look at it. So if they're symptomatic, 10 days, 24 hours afebrile, significant decrease in symptoms. Now that may be a total of 10 days because their fever may go away after 3 or 4. So at the end of 10 days, they could come back to work. And then lastly, work closely with the health department. If you have anyone within your area, any employees, any colleagues that are positive or you're concerned, reach out to the health department. They will help ensure to get them tested. Will help ensure that we get them properly evaluated and do the contact tracing if absolutely necessary. That pretty much covers it from my standpoint, but I'd be real interested to hear what questions people have that I didn't cover that you'd like to know about.
So I've written down some questions. Is this a good time? Is it okay?
Fire away.
All righty. So I've got 4 actually. Sorry. But some of them I think you've already answered. If we get a staff member who tests positive and they're home sick, if they have an office, we can close the door. And a salesman wanted to sell me some foggers yesterday. And you said clean as well as close that office for at least 24 hours. I'm thinking a few foggers might be handy. We could fog the office and we wouldn't have to go in there and clean.
I don't know the effectiveness of the foggers, but make sure you're doing it in the right order. Close the office and leave it alone for 24 hours.
Right.
Don't go in, don't do anything. And then whatever process that you feel is appropriate from a cleaning standpoint, whether it be wiping down the hall, the areas, a fogging mechanism, whatever is appropriate after that 24-hour time period is when you do it.
Right. And I should have said, I'm Molly Westmoreland I'm the director of the Wilson County Public Library. We've met before.
Yes, we have.
So we're doing cleaning every morning. We are open to the public and our staff have never stopped working. But while we were closed, we all have always worn the cloth face coverings, which we made in our makerspace. So we're really proud of that. But
Very good.
That's good. So it might even be better to just go ahead and clean in there with the disinfectants we already are using. Wait the 24 hours and then go in there and just clean the high touch surfaces.
That would be my recommendation, yes.
Great. So we don't take temperatures of staff, and we talked about this, and I talked with Teresa Ellen about it. We went back and forth, but and you tell me, but what we're doing is we are all presumptive positive. We assume that we are all sick, asymptomatic with COVID, and we behave accordingly. We are thinking that this might be just as well, since people can shed the virus without the least amount of fever. So should we revisit that and get those no-touch thermometers? What do you think?
I will be very honest. I don't know that it's absolutely necessary from a thermometer standpoint. I do think what's probably more important is making sure that everybody's healthy that comes to work.
Right.
That there's no symptoms at all, that they don't have a new cough they got this morning that they haven't had before, that they're not having a headache that they haven't had before.
Yeah.
You know, those type of things. I think that's equally important to the temperature. And I think then making sure that everybody is wearing a mask and doing all of the items that you're discussing while at work, cleaning the high touch areas on a regular basis, you're doing the right stuff.
Good, thank you. And we have gallons, literally gallons of hand sanitizer and all throughout the libraries. Every horizontal surface just about has a gallon of hand sanitizer. And so we're all using it all the time, and we have dry skin and all that. But anyway, that's okay. So the executive order, we have a little table as customers come in. We look at to see that they're wearing a mask. We have a sign on the door that says masks are required. But there's an exemption. If they don't have a mask, we give them one. We have paper masks to give to people. And there's an exemption in the executive order for people with medical conditions and who can't wear a mask. And honestly, this can't go, this is private. This can't leave this Zoom room. But
fair enough.
I'm a little little skeptical, honestly.
Oh,
And
hold on, Molly. Molly,
yes,
before you get
before I confess,
before you get into too much trouble, I just want to remind you that we are recording the meeting. So
okay, I'm
we can only be but so private. We just want to warn you.
Thank you. That was a good reminder. Yeah, all right, I'm going to be very tactful. We are concerned when a customer states they will not wear a mask for medical reasons and then goes on to tell us that the pandemic is a hoax and that Governor Cooper is wrong. And they begin to have a political discussion with us. And we say, oh, we don't need to talk about that. You're free to come in. We do offer them alternate services, but if they don't want those, we do allow them to come in. We remind them to social distance. We alert the other departments to just keep an eye and make sure that they do social distance. But I'm just curious, what medical and I'm asthmatic, and I wear, by golly, I wear mine. What kinds of conditions would preclude the safe wearing of a face covering? Should we skip that? Is that the bad question?
So typically, it's somebody that has significant respiratory issues. So potentially someone with COPD, someone with really severe asthma, some people with congestive heart failure, because they have trouble breathing through that mask, even though it's a breathable type mask, they have that issue. So that's really where those are the patients you think of that may have issues. We've actually have one nurse that has had problems wearing a normal surgical mask daily because her skin breaks out. And so we've had to work with her on different options, a cloth mask underneath the surgical mask, so that she is doing the right thing, but it's also protecting her skin.
Yeah.
So there are different circumstances like that. What I would encourage in those situations is if they can at least have a scarf that they could throw across their mouth, like if they were out in a cold wind, something of that sort, at least that's helpful.
Yeah. And I'm so glad I asked, because I do feel better. Thank you. And I will be more compassionate, and I will encourage my staff to be more compassionate, because even if someone is irritated with the pandemic and whatever decisions are coming around that, they could have congestive heart failure or some really serious condition. How about face shields? We've made a few of those in our makerspace. Is there any medical reason not to wear a shield, a plastic?
Actually, there's good medical reason to wear a shield. And that's also one thing that can be in place of a mask if it's a shield that comes down far enough. All right. Because what you want to do with the shield is very similar to the mask, in that it blocks any aerosolized products from getting beyond that shield.
Yes, good. So if we offered that, that would actually be a service to someone who could have a really difficult breathing problem, and that would help. I would imagine it would help to keep them at least somewhat safe.
Yes.
From droplets hitting their eyes and so on.
Certainly should.
Okay, all righty. We'll see if we can do that. That's great, thank you.
You're welcome. Was that all four?
The other one is, well, I'm thinking if they can't wear a mask, should we offer them an isolated space? And that's just something for us to think about, whether we can offer them service in a different way and maybe protect them as well as our other customers. That's something for us to ponder, I think.
And that's something I would consider as well.
Yeah, good. Thank you so much.
You are welcome.
Dr. Stahl, we have a question in the group chat. You had mentioned that those who have tested positive are likely not contagious after they've not had any symptoms following the 10-day period. However, are people contagious when they're in the incubation period? They've contracted the disease, but have not exhibited symptoms yet.
They are, but less so. They are still contagious. There's still the risk of transmission during that incubation time period. The evidence suggests that they are less infectious, but there is still evidence of transmission prior to, which fits along, if you think about it, goes right along with those that are positive but never develop any symptoms. Though they are likewise infectious, but probably slightly less so than someone who's truly significantly ill. What other questions can I answer?
So I guess I need to ask too. I think one of the scariest aspects of this disease is that it spans a large spectrum from asymptomatic, somebody who's not exhibiting any symptoms whatsoever, all the way to death, and just about everything in between, it seems. Based on what you've observed, how many of those positive tests have come in from people who are asymptomatic? Presumably, most of the people who request tests are having symptoms. So I guess most of the positive tests of asymptomatic people come from the contact tracing. But I'm curious, based on your observation, that how many of these positive tests are out there? How many people are walking around right now that have coronavirus that we have no idea they have it?
That's the $50,000 question, and I don't know if anyone knows the answer to that. We know that there are a lot of asymptomatic patients who are out and about who would test positive if we tested them or if they chose to be tested. When this disease first hit the US, and I think you've heard this a lot on the news, we were horribly unprepared from a testing standpoint. So we were not able to test nearly the number of people that really we should have to help curb this disease and better understand the spread. We're much better at that now, but our testing supplies are still not endless. We're still in a situation where a lot of organizations, a lot of states are somewhat selective in who they test to a degree. Mm-hmm. So we really don't have a good handle on how many are out there. We know that of those that have tested positive, the majority, probably 80% of them, are minimally or asymptomatic. So they have minimal disease or are asymptomatic as a result. The sad part is we know those that get sick can get sick very, very quickly. We've had patients at the hospital who came in who needed a little bit of oxygen help, looked like they just had mild to moderate disease, need to be here for a couple of days, and 3 or 4 days later, they're on a ventilator in the ICU. Because this disease can get very, very bad very, very quickly. We do have some treatment that we use, obviously. The most recent recommendations are steroids and a medication called remdesivir. Now, remdesivir is an antiviral given for 5 days that has shown some evidence of really helping these people. But it's not a cure. And it's not nearly 100% as far as the success rate. So we're still learning. We're still learning a lot about this disease, the prevalence, the total treatment, pathophysiology, the whole bit. And I think we will continue to be learning probably for another 12 months or so.
Mm-hmm.
Hey, Ron, it's Bree with the Wilson Times.
Hello, Bree.
How are you?
Good.
Thank you, Ryan, for putting this on. I've got a question in terms of employers that do have a employee that tests positive. What do they need to do with regards to letting their customers and the people that they interact with know about that, whether it's a restaurant or like I had to quarantine because of a infection or exposure. But I know that wasn't shared with our Wilson Times customers. I shared it with the people I'd been in contact with, but I wasn't sure what should be the process as far as our businesses letting the community know, hey, we have this, we're dealing with it. We just want to let everybody know.
So unless you have a big outbreak within a business, and most of the time those are healthcare businesses, to be honest. You got frequently your long-term care facilities, assisted livings, and so forth. Unless you have a significant outbreak, I would really encourage that any discussion and decision regarding quarantine rest with the contact tracer process through the health department. They have the ability and the expertise to spend the time with the customers, spend the time with the people, the ones who were exposed, to determine what was the exposure. How long were you with that person? Were either of you wearing a mask? Were you wearing a mask part of the time? How close were you? These type of things, because that's all part of the contact tracing and really important to make that determination as to who should or should not be quarantined. I will not sit here at any point and tell a business, if you have an employee that turns positive, you need to publicly announce that. I don't think that's going to benefit you, and I don't know that it benefits anyone else either. Really work within the health department to make sure that you're doing the proper contact tracing.
Thank you.
You're welcome.
Dr. Stahl, another question from the group chat is, how would somebody know if they need to be tested even with no symptoms? For example, those who aren't showing any symptoms but have been in contact with someone who tested positive a few days later.
So that's the whole trick of it, is trying to figure out who you need to test in those type of circumstances. So, for example, if you have a situation where a family member turns positive, and obviously you live with that family member, again, the health department is going to talk to you about whether it's important to test you. But there's two factors that come into play. One is, are you symptomatic at all? And second of all, when would you test? Because what you don't want to do is test immediately, have it be negative because it's still too early in the process of the disease to be picked up, and give someone false sense of security. By and large, the majority of the time, the recommendation is quarantine and observe for any symptoms before you test. Does that make sense?
Any more questions for Dr. Stahl before we close the event? Well, again, Dr. Stahl, we're very grateful for your information and your service, and I hope you will give our best regards, especially to those frontline workers there at the hospital who are treating patients and facing this stuff every day. We appreciate everything that you guys are doing at Wilson Medical Center, and again, grateful for the information, and thank everybody here who's participating. And again, we'll make this Zoom recording available just as soon as we can for later distribution. I appreciate everybody's participation. Thank you.
And I want to thank everybody real quick just for all that you do for the community and all you've done to help support Wilson Medical Center through this. Thank you.